Hi, everyone. Thank you so much for joining us for this second part of the health mobility and migration partnership. We had an exciting, fascinating section in the first part. And the second part, we have Dr. Ayodele from the University of Ibadan as our discussant for today. Thank you so much for coming. Therefore, we have three presenters for this part, for this two panel. And the first presenter is Israel Ujubila from University of Kansas. He will be talking about from here to the land, aviation, cities, transmission, and public health system in Africa. So Ujubila will be joining us here soon. I will look forward to this presentation. The second presenter will be Paul Omoni and Chima Ekenyawu from the University of Social and Behavioral Health Units of Child Health College of Medicine, University of Ghana. And they will jointly be presenting on historical epidemiology of zoonotic infections in Nigeria, a social historical discourse of bubonic plague and monkeypox. And the last presenter will be Abibat Bright from the University of Ibadan, who will be presenting on fertility dilemma of Nigerian women, 1960 to 2000. We look forward to this fascinating panel, and we will start this panel short, in a very grandiose way. And each presenter will have 12 minutes. Since we have just 3 presentations, so each presenter will have 12 minutes. After the presentation, the discussants will then talk about points, the interconnectedness of this, diverse presentation, and also raise questions before we then open the presenters to other questions from the audience, right? So I hereby invite Israel Gujumila for his presentation. I don't think he's on again.
I think he was there.
He was there earlier.
Where?
Yes.
Yeah, he was there.
He wasn't. He was.
He was.
I saw him.
Yeah.
Okay. I think we can just move forward to the presenter now. President.
Yeah.
Okay.
Yeah. So I do then invite Ikeyafu, Chima, and Paul Money. Thank you. 12 minutes. I'll be trying to keep on.
Thank you so much.
Okay. Go on.
Yes. Good afternoon, everyone. My name is Paul Omoni, and I'm here to present a paper titled Historical Epidemiology. Historical Epidemiology of Zoonotic Infections in Nigeria, a socio-historical discourse of bubonic plague and monkeypox. One of the issues facing Africa, one of the issues facing Africa currently stemming from the polycrisis of not just climate change, is the polycrisis of zoonotic infections that are looking at monkeypox. We've had issues on avian influenza and some other health issues. Next slide. So these are the major signs of monkeypox and the transmission route to include both human to human transmission and then human to animal contact, which is basically the origin of the monkeypox transmission route. Next slide. That's the table of content. Next slide. Now, infectious diseases continue to pose a serious threat to public health. Mpox, as we know, is prevalent in Nigeria with recorded cases in Adamawa State. Colonialism and the severity of pandemics to include bubonic plague in Lagos in 1924 to 1935, the influenza epidemic in 1918 to 1919, smallpox 1918 to 1939 in Ibadan. Pandemic urbanization in West Africa and the changing demographics coupled with family dynamics have resulted to different spread and patterns of zoonotic transmissions. Epidemiology of human monkeypox in Nigeria are to cover Adamawa, Rivers, Oyo, yet several initiatives have failed to put an end to this unpleasant trend. Although we've had clinical trials and evidences, but then it's also look at, despite empirical studies and investigations aimed at understanding the social phenomenon, developing nations in particular have been the targets of deaths and benefits. Urban poor and stigmatization of African impoverished people has fueled the indigence, coupled with significant negative impact on social welfare, as well as protracted economic downturns. Next slide. Now, these are the research where the main objective of the study was to understand the factors that contribute to the transmission and spread of monkeypox in endemic regions. However, the specific objectives were to investigate monkeypox transmission through historical and cultural context in endemic regions, document traditional practices and beliefs that influence the spread of monkeypox, investigated public health interventions across endemic and non-endemic regions, and then analyzed sociological factors that influenced the spread of infectious diseases endemic in Central and West Africa. Next slide. Now, the significance of the study was one, to understanding monkeypox transmission also is to inform public health interventions across endemic and non-endemic regions, the adoption of a One Health approach, insights from previous epidemics and future public health interventions through policies, stakeholders collaboration, and global health security. Next slide. Now, the theory we used was the eco-social framework. And this framework establishes the relationship between social, economic, and environmental factors that influence the distribution and impact of diseases to limit the impact of future epidemic illnesses on mankind. It is critical to comprehend the interrelated biological and social elements that functions across many dimensions, ranging from local to global. And that's the that image starting from the local transmissions of diseases and how diseases continue to spread up onto the global spread, just like we had during the COVID-19. So that functions across many dimensions. Next slide. The methodology, the design was exploratory and descriptive. The study area was in Lagos and Ibadan, where we interviewed bus drivers aged 50 and above. It was a convenient and purposive sampling. Our method of data collection was basically primary, using qualitative in-depth interviews and then archival records. Data was analyzed inductively using content and thematic analysis. The selection criteria for interview was the age, residence, experience, occupation, and then availability stroke willingness, as well as ethical considerations. Now, findings. These are some of the excerpts that we got from the archival records, as well as the interviews that were conducted among bus drivers. And the major issues that we discovered was, one was trade, the complexity between trade and migration. Also, the interconnectedness, as the world is becoming a much more global village. We begin to have much more complex human interactions, increased travel, and increased trade, which have influenced the spread and outbreaks of zoonotic infections that we have now, as well as human exchange of body fluids, coupled with traditional practices and beliefs about food consumptions and taboos, like in some communities where they still have to consume certain meats, even if public health interventions or strategies have placed a ban or have informed us not to eat most of these things. However, some persons still prefer to eat local game meat because they feel that is their best form and that their forefathers have always been taking that over time, despite the risk associated with eating this meat. Next slide. So this is a picture showing the human to animal contact, animal to human contact, and then animal trade, which is still prevalent in contemporary times. Even today, we still see how people are being moved even from northern Nigeria alongside animals. Even in some places in Shaki, people are placed alongside varying forms of animals to move them alongside. All of this could influence the transmission route and also help us to establish trends and patterns in terms of disease transmission. Next slide. Results. Public health interventions across endemic and non-endemic regions. We see consumptions of game meat, sensitization, awareness. There's a problem of sensitization, problem of awareness, and problem of education. This also emphasizes the need for sanitation, cleaning, isolation, and hygiene practices. Although archival records showed back even during the bubonic plague in Lagos, the colonial masters in some regions established stakeholder forums to checkmate for sanitation, to checkmate for cleaning. However, in some other parts, there was no measures put in place, and that was why I said Africans as field agents by the colonial masters. This is also a picture of previous plagues that we have had and how the death toll continued to arise even up to now. Next slide. So sociological factors and disease transmission, we found issues of rituals, religious beliefs, animal trading, and then illicit sex. Certain cultures consider rats as an edible delicacy when hunted in villages. Next slide. Conclusions. Zoonotic infections are influenced by a number of socio-economic, cultural, and historical contexts. Global connections, cultural norms, and human behavior impacts upon spread of diseases. Unapologetically, these are my major concerns. Cultural dynamics, paralyzed surveillance systems, inadequate data, geographical and contextual variations, weak collaborations at both micro and macro level influence diseases transmission. And recommendations are cultural sensitive interventions are needed. Holistic approach using the organismic analogy of the whole is greater than sum of its parts. And then collaboration is vital in strengthening partnerships across various units like the medical department, law enforcement, and other agencies like Marine Customs, police to enforce sanitary practices. Contextual policies that would aid in implementation and impact using the One Health triad. Thank you for listening.
Thank you very much. Let's check if the presenter online is there. Yeah, is there. Israel Ogundumila. Can you hear? Is he on? Okay. I think you can come up with your presentation. You have 12 minutes.
Okay, thank you very much. Unfortunately, I don't know if I'll be able to share my slide. If I can get a help there, that would be lovely.
Does it have a slide? Okay, they are going to give us your slides here, so you can go on.
Okay, thank you very much.
Okay, you can share your slides.
So I'm actually doing this on phone. I don't know how that is possible though.
I think it's possible.
Okay, share screen.
Yeah, you should be able to do it.
Oh, I'm so sorry. Okay. Am I live?
Yes, you are.
Can you see my screen? I mean, can you see my slides now?
I don't think we can see it. The phone is, if you can, the phone is not projecting it well.
Okay.
Do you have it?